Hey everyone, welcome to our continuing education series. Today we're going to talk a little bit about neck pain with Dr. Dina Khentigan, but a few housekeeping tips first. Always consult your physician and get evaluated before starting cervical traction or starting any kind of medical device. This video is just for education to let you know what's out there on the market. So Dr. Khentigan, please tell us a little bit about yourself.
Well, I've been a healthcare professional for over 35 years. My terminal degree is a doctorate, and I'm also certified in integrative health.
So today on neck pain, how prevalent in the United States is neck pain?
Oh goodness, neck pain affects about 10% of the adult population, so it is pretty prevalent.
Wow. 10%. What are some examples of how I would get just a common example if people don't really think about? How would I get just common neck pain?
You can get it from a variety of ways. It could be due to injury, or it could be due to chronic overuse. For example, have you ever heard the term tech neck?
Yeah, yes. Just thinking that.
Right. So that extended flexion all day long. It could be due to golf injury. It could also be caused by other problems, such as a pinched nerve or from herniated disc.
So it could be from just common day use or from maybe overuse or just, unfortunately, old age. What are the majority of patients doing for neck pain?
What some patients are doing at home, they might be taking over-the-counter products such as acetaminophen or ibuprofen. They might stop doing what causes the pain. So for example, a lot of golfers might have neck pain because they're rotating the neck and they're flexing the neck for long periods of time. So if they stop playing golf, or maybe they folks limit their time that they spend on their tablets and smartphones, that can also help. Some people might go to physical therapy, or they might maybe get a different pillow at home, or something to help that neck to be in a different position.
I can imagine once it gets going, it's probably really uncomfortable. So the anatomy of the cervical spine, can you just kind of describe a little bit in layman's terms what that is?
Absolutely. So the spinal column consists of a bunch of bones that aren't connected. They're kind of stacked one on top of each other. And the first 7 bones in the spinal column are called the cervical vertebrae, and there's 7 of them stacked on top, and in between the vertebrae are these discs, and that kind of helps cushion the vertebrae. Also, there's 8 nerve roots that innervate the cervical spinal column, and they connect to different parts of the body. That's why some folks that have neck pain may also have some weakness, numbness, tingling in other parts of their body, such as their hands or their feet.
That's a good point. So that would be stenosis if you get some tingling, would it not? Or what is stenosis?
Well, stenosis is actually a narrowing of the spinal column. So if the spinal column is narrowed, then that may cause some compression on the cervical nerve roots, and it can also kind of squeeze the disc and that might push them out of the vertebrae.
And what are the other things? There's a herniated disc, and then there's that word I hate to use that we see a lot when talking about neck pain. Can you go over those couple things?
Radiculopathy is basically just a fancy medical term for a pinched nerve. And then you have stenosis, which we've already discussed, which is the narrowing. And then there could just be some wear and tear due to aging that might make the vertebrae closer together, that can compress on those discs or the nerves.
Okay, so with that being said, how can, in this case, the comfort track is the one we're going to talk about. How does a cervical traction benefit a patient who might be experiencing some of these issues?
Oh, that's a great question. So basically what the cervical traction does is help to kind of put the cervical neck into a neutral position and help stretch it out a little bit so that there's not that compression on the disc, which are in between the vertebrae, or not that it can kind of prevent the compression on the nerve roots, which can also cause that pain, numbness, tingling, or weakness.
So the traction unit is really, in layman's terms, just going to kind of pull things apart to maybe help alleviate?
Absolutely, absolutely. And then too, it can help maybe, we talked about the tech neck. For folks that are constantly in that flex position, it can help prevent someone from bending their neck down into that flex position.
So this is a really conservative treatment, but you should always talk to your physician and talk to your PT, especially on the poundage you would use on the cervical traction unit. It's always better to start conservatively, maybe just lay in the unit and put 10 pounds of pressure on it and just see and sit there and just let your neck stretch versus, maybe doing a much harder pound or higher pounds, I should say.
Yes, because observational studies have demonstrated that about 40 to 80% of people, their pain, numbness, tingling, or weakness might be elevated by conservative therapy. It usually takes about 6 to 8 weeks, but if the pain or other symptoms worsen or don't get better, then, like you mentioned, folks definitely need to contact their healthcare professionals.
Well, I hope you enjoyed the video, and thank you so much for taking time to explaining the basics of that. If you like this video, please comment below or like it, or subscribe to our channel, and we will link Dr. Dina Khentigan's article below in the comment section. And thank you for following along.